Hello, welcome to Discussing Fitchburg Now. I'm your host, Sam Squalia. For this week's show, we are talking about the COVID-19 vaccine, and we are talking about the Vaccine Equity Initiative within the Fitchburg and Leominster area. This is brought to you thanks to Fitchburg Access Television and the Workers Credit Union Studios and virtual studios, as our guests are on Zoom. So what we're going to do for this show today is we're going to first have our guests and me, your host, Sam Squalia, talking about the COVID-19 vaccine and the Vaccine Equity Initiative. In the second half, we will have a co-host, a guest co-host, Alexander Vera, and he will be doing the interview in Spanish for our Spanish-speaking audience. So up with me now, I have Cecilia Luján. She is the Health Communications and Outreach Specialist for the Massachusetts Department of Public Health. And in addition, I have María González, who is the Project Director for the Vaccine Equity Initiative on behalf of Healthcare for All. Thank you for coming on.
Thanks so much for having us, Sam.
Yes, thank you so much for the invitation. Good afternoon, everyone.
Okay, great. So the Vaccine Equity Initiative works with the populations and communities in Massachusetts that were hardest hit by the COVID-19 pandemic. And this is 20 communities that were hardest hit, of which Fitchburg and Leominster both are one of the 20 communities. It takes into account COVID case rates, in addition to the social determinants of health and the disproportionate impact of COVID-19 on our Black, Indigenous, and people of color population, of which the Fitchburg Leominster area has a higher percentage than the state average. Correct. Okay, so thank you for coming on. So first, let's talk about the COVID-19 vaccines, how they work, what we can expect when we get them. And then we'll talk specifically about what's happening in the Fitchburg Leominster area with the Vaccine Equity Initiative. So let's start with you, Cecilia, with an overview of the COVID-19 vaccines. We have the Moderna and the Pfizer, which are 2-dose, and the Johnson & Johnson 1-dose vaccine. Let's talk about first how COVID-19 vaccines work to protect us against the virus.
Well, Sam, any vaccine, the way they work is that they help your immune system produce antibodies, just as if you had been exposed to disease. After getting vaccinated, you have the protection from that disease without having to get the disease first, which makes vaccines a very powerful medicine. Unlike other medicines which treat or cure diseases, vaccines prevent them. So as you've said, for the COVID-19 vaccine in the United States, there are 3 options. There is Moderna and Pfizer, which are both vaccines that require 2 doses. And then there is the option of Johnson & Johnson, which requires only 1 dose. Having said that, even after getting the vaccine, we still recommend that people socially distance, that you continue to wash your hands and all of the such, because it does take time for the vaccines to, in layman's terms, kick in. The Moderna and the Pfizer vaccines require 2 doses. So when you get your first dose, you have to wait 3 to 4 weeks, depending on if you get Moderna or Pfizer, to get the second dose. Johnson & Johnson was made thinking of the person who just wants one and done. And after those vaccines have been applied, if you get the one that is 2 doses, you should wait about 15 days, 2 weeks, before considering yourself fully vaccinated. With the Johnson & Johnson, you would just have to wait the 2 weeks after your first dose.
So the benefits to getting the COVID-19 vaccine, this prevents the virus. What are the other benefits to getting it?
Well, the way the vaccines work is that they have like a message. They'll call it protein. That message is received by your body, by your immune system, to know how to fight against the COVID actual virus. So your body may feel side effects while it is learning how it should fight against COVID. Having said that, the benefits aren't just for the people who receive the vaccine, but the people who also live with you. So, for example, I have a 4-year-old and a 6-year-old at home. There are no vaccines for them. So, in order for me to protect them, I should be vaccinated, which I was luckily able to do. I also have a mother who has AFib. She has heart conditions. She has high blood pressure. She has this. She's like a walking pharmacy, my dear mother. And she was luckily able to get vaccinated before I did. But in my getting vaccinated, I'm also helping people like her maintain her health, maintain her immune system. There's also, now that we've advanced so much throughout this process, there are certain places that require proof of vaccination in order to go in. There are places, not just travel-wise, but even the other day, I think my 19-year-old son wanted to go to a salsa club, and they were like, you need to show proof of vaccination.
Oh,
and he was like,
wow.
oh yes. Over in Cambridge, I believe it was Havana. And I was like, oh, okay, this is something I must share with all of your friends, because it's now not just your ID that they're asking for. They want to see proof of vaccination, which, I mean, if you're dancing salsa, I think that's a pretty close call in contact with somebody that you might not know where they've been earlier that day or any other part of their routine. So mostly it's not just to keep yourself safe, but you're keeping everybody around you safe as well.
So you're helping to not only protect yourself, but you're helping to protect the people that cannot be vaccinated around you.
Or are at a higher risk of contracting COVID-19 as well. Because even if you are vaccinated, you can catch COVID. That is something people need to be very aware of, which is why we still want people to wash their hands. We still want people to socially distance. But what the vaccine helps your body do is know how to react against COVID if it is facing it. If that, I hope I'm being clear about that. The COVID vaccine does not prevent you from ever getting COVID. It gives your body a roadmap and like an action plan of what to do if it were to face it.
So it's already practiced its role in fighting it. So now it knows what to do rather than be totally overwhelmed.
Completely.
So some people wanted to wait until everyone else got it because they were concerned that the vaccine, of its safety. So how can we be assured that the COVID-19 vaccines are safe?
So that's a great question. I want to give a little backstory so that everybody understands where we're coming from. Even though I work in public health, I was very surprised with the timing of when the vaccine came out. I'm more used to medications taking about 4 years to be approved by the FDA or CDC. That's like the quickest. But there are huge points to keep into consideration when thinking about the COVID vaccine. COVID-19 paused the world. Not just the United States, not just the countries my parents are from. Economies around the world were paused because of COVID-19. COVID COVID has existed before now, but the COVID-19 was much more contagious than anything we've seen before. So there's been work, there's been study, there are people who dedicate themselves to studying COVID. When everything stopped with the pandemic, everybody's attention and the buzzword was COVID-19. So now people that were working on different medications, who were working on different vaccines, all had to reel in, bring their knowledge to the table, and kind of give a daily report to the presidents, to the directors, to the people in charge who wanted to find a solution. So first of all of the attention focused on COVID-19. That does not mean that it was not tested. That does not mean that data was not collected. It means exactly the opposite. Everything happened at lightning speed because that was the only thing everybody was focused on. The other thing that cut the waiting time in the vaccine creation is that manufacturing started at the same time as the FDA and CDC reviewed the data in order to give the approvals. So that is a huge difference that cut time. That does not mean that corners were cut. It still means that people were tested not just in the United States, all throughout the world. Different races, different age groups, different considerations were taken into, were brought to the table when considering the emergency use authorization. And there's also proof of that because not every age group has been approved at the same time. When we were able to approve one age group, then they started testing on the following. As of right now, from 12 on can be vaccinated with Pfizer. 18 plus can be vaccinated with all three. And the work continues to this day because we want to be able to have a solution for everybody who looks for the vaccine. So it is something that even public health professionals were like, oh, that was fast. But as I read, as I asked, and I believe everybody has the right to ask and garner that information, you realize what made this vaccine different in terms of its approval process.
So it's amazing what we can accomplish when a worldwide effort is put towards it.
Absolutely.
So for those of us who have not yet gotten the vaccine, what kind of side effects can we expect to experience when we get either the two-dose Moderna or Pfizer or the Johnson & Johnson one-dose vaccine?
So I can speak of my experience, not just what I experienced, but the people around me. I have a sister who's a nurse. I'm one of 8 sisters, so
wow.
We're all throughout. My mother received the COVID vaccine in February of this year. Last year in February, she actually had COVID. So even if you've had COVID, it is very important that you do receive the vaccine. And when she received the vaccine, she actually got side effects on the first shot, not on the second one. She got Moderna. Her answer, she got chills. She had a fever. She felt groggy. After 22 hours, it was all gone. And she told me it was much easier than actually having COVID. I was like, okay,
Oh, yeah.
That's a motto I'm going to share with people. My sister, who's the nurse, also had COVID in March of last year. When she was vaccinated, she felt fine. She felt nothing. She received Moderna as well. I got Pfizer. The first shot, I had a dead arm. So I made sure to get my shot on my left arm. The second shot, I did have a slight fever. I had chills, and I was kind of dazed out for the most part afterwards. I have had friends that have felt nauseous, that have felt headaches, and most of them have felt fine within 24 hours. What we do suggest is people to have ibuprofen after the shot, never before, You should wait to see if you have side effects, drink lots of water, and also, while I do tell people to take their side effects very seriously, keep in mind that a part of it could also be anxiety of going through this process. And I understand that. You don't usually go to the doctor to get a vaccine for this situation that has halted an entire world, that has killed people we know and love, that has affected so many. So I definitely understand the anxiety, and I am not trying to belittle what people are feeling, but to keep in mind that that can also play in a role into what you're feeling while you're going to get the vaccine. Having said that, anything you're feeling, you should definitely go to your primary care doctor. You should definitely share it with them. The worst that can happen is that they say everything's fine. And if anything isn't fine, they would definitely follow up. And keep in mind, when you're getting vaccinated, if you suffer from allergies, it is very important that you mention that at the time of getting vaccinated, because they ask you to stay a little bit longer in order to make sure that everything is okay. People who do not have allergies are asked to stay a total of 15 minutes in order to see if any side effects show up right there and then. And if you have a history of allergies, which my mother, of course, does have, she had to stay half an hour, and she was fine. She did feel the side effects about after 10 hours or so, which is what I have heard for the most part with other people as well. Most of it is gone after the 24 hours.
Okay, does the COVID-19 vaccine protect us against the variants that we're hearing about, particularly overseas?
So there is a lot of talk about that because the vaccine is very new, be it whichever one of the brands we speak of. Research has been done to show that Johnson & Johnson has shown a higher tolerance against the different variants. Pfizer, I believe, is looking into whether there is a need for a booster shot. There isn't enough data to say that it is needed. As of right now, the only one that has shown proof to work against the variants is Johnson & Johnson, which is why we still tell people, please wear masks if you feel uncomfortable in the situation you're going into. Wash your hands, socially distance. These are things we should be doing anyways. If anything, the COVID-19 almost halt to the world has just shown us that there's a better way to wash our hands and socially distance, and we shouldn't be sharing that drink yet. But that's not to say that you shouldn't do it because there isn't data against the other two. Johnson & Johnson was just able to provide the data yet. It's still being studied to this day.
And so that's another reason for getting the vaccine is to help
Absolutely.
prevent these variants from occurring.
Absolutely.
Okay, Cecilia, thank you so much. To close out, how do we get the vaccine here in Fitchburg, Leominster? I know that we have them available at CVS and Walgreens. Should we? Is there the sign up online? Has that ceased?
So Massachusetts was having a website where you could pre-register and register. I believe that ended on the 28th of June, though. I believe Maria does have more precise information regarding Fitchburg and Leominster, though. So Maria, please take it away.
All right.
Absolutely. So this brings us into what's really happening in Fitchburg and Leominster, and we're really uniting efforts. We have engaged with different community-based organizations that are helping provide information about the vaccine, but also they're actually hosting clinics in partnership with the community health center. And one thing that I wanted to flag is there are these vaccination clinics happening in Fitchburg and Leominster, and then being organized week by week. So we are trying to bring the vaccines really where you are. And there are other options such as home vaccination shots. You can get your shot actually at your house. So my recommendation for people who reside in Fitchburg and also in Leominster is to reach out to the two community-based organizations that are lead in Fitchburg, which are Making Opportunity Count and New View. And those two organizations are helping us bring the information directly to the residents in English, Spanish, and other languages, I believe Portuguese as well. So I think that is the best bet to know where we are. We don't have a clinic, as far as I know, scheduled for this week, but I can definitely find more information about where those clinics are happening, and I will recommend you to really reach out to those two community-based organizations. We also know that the community health center is offering vaccinations. My understanding is that you have to make an appointment in order to get the vaccine, and then we can definitely connect you with the vaccine, and you can go to CVS, and you can go to Walgreens, etc.
Yep, and we, I've seen the mobile vaccination clinic, which is the bus, has come a few times. We had the train. Also, there was the train came, and you were able to get the vaccine right on the train in Fitchburg. And these initiatives through the Making Opportunity Count and New View Communities, through our community liaison, these are walk-in clinics that you need no appointment for as well, correct?
That's correct. Most of the clinics right now offering the walk-in opportunity. In some cases, you do need to sign up. I believe that's the case with the community health center. But when we put together clinics with New View and obviously Mock, they are walk-in clinics. You can show up. It's important for us to sign up because that way they know how many vaccines are needed, but that doesn't mean that you have to do it. It's just like to coordinate. And what we do is, what they do actually is sign people up if needed. They provide the information that they need, and we have flyers, and we have these canvassers. We have people knocking on doors that are wearing these uniforms, and they usually carry their flyers with them, and they give the flyers with the vaccination clinics that are upcoming.
Great, thank you, Maria. Can you tell me the vaccine, does it cost us any money? Do we need to provide ID? Do we need to provide proof of insurance? And can families get this vaccine if they are undocumented?
Well, the vaccine per se, it's free for consumers and residents because it's already being paid for by the federal government. But the administration of the vaccine has to be paid. And the ways that it gets paid is actually, one is if you have health insurance, your health insurance actually pays for it. And if you do not have health insurance, the provider gets reimbursed by the federal government. I'm saying this because it's important for people to know that it's free of charge to them, to the consumer, to the person that receives the vaccine, no matter what. And that's why, even though they may ask you about your ID, they may ask you about your health insurance, the truth is that you don't really need it. They just need to know who's going to pay for the administration of that vaccine. Now, the question that you had is, do you really need an ID? Do you really need health insurance to do this? Well, the truth is they're going to ask you for your ID because it's important for them to keep track of like who's getting the vaccine, so it's important. If you have the ID, it's better to show it because it's going to make things a little bit easier. But if you do not have an ID, you do not need an ID. And if you have health insurance, as I said, the insurer will pay for the administration of the vaccine, and it's good to keep track of, if you have health insurance, that's what's going to happen. If you do not have health insurance, you just have to say, I don't have health insurance, and that will be reimbursed by the federal government, the administration of the vaccine. They will pay directly, the providers directly. Now, I always say there is actually no reason why you wouldn't have health coverage in Massachusetts. We have options for all residents to have different kinds of insurance, regardless of your immigration status. So you can apply for different programs. I always recommend people to call our helpline, Healthcare for All helpline, which is 800-272-4232. You can call, we can help you with your health coverage. If you're undocumented, if you have a visa, if you have TPS, which is temporary protected status, whichever status you have, we can help you. And another thing that I wanted to add is, since you asked about undocumented, of course you can get the vaccine if you're undocumented. There's no impact on immigration status. Or if you're an immigrant who's applying for a green card or applying for a visa, there is no impact. This is not part of what's called the public charge test. The public charge test is this test that can prevent you from adjusting your immigration status, there is no impact on your immigration status or your immigration process at all to have the vaccine. In fact, I would say it's better to prove that you actually got the vaccine because you're helping everybody be safe around you. So that is my recommendation. Get health insurance and get the vaccine. They're actually going to help you in your immigration status if you think about it.
That's great, Maria. Thank you so much for all the information, and Cecilia on the vaccine. Now, I'd like to shift to talking about the Vaccine Equity Initiative, which helps allow the state to provide for those 20 hardest hit communities like Fitchburg and Leominster. So can you talk a little bit about the Vaccine Equity Initiative and what it means for Fitchburg? What extra support are we getting to ensure an equitable distribution of the COVID-19 vaccine, and for us in Fitchburg who was more harder hit than a lot of the other communities in Massachusetts?
That is a great question. I'm just going to clarify that this Vaccine Equity Initiative is actually a very large initiative that has many components to it. The part that I'm going to be discussing and talking about is really the education efforts that we're doing in our communities, in our streets. This is a partnership in between the Department of Public Health and different entities. In our case, it's Healthcare for All working with another organization called Archipelago Strategies. And Healthcare for All is providing a team of what we are calling canvassers, people that are not on your door. They're equipped with a t-shirt that says trust the facts, get the vax, and they also have a hat, so they're uniformed, that you can realize that they come in like really representing the program. They have information that they can give you at your door. They speak different languages, and they really want to make sure that you have the information you need about the vaccine. If you have questions, they want to understand if you have any barriers to access the vaccine, or if you have any questions, any concerns about the things that Cecilia was talking about before. So, side effects or safety of the vaccine, and what was it developed so fast? So people may have a lot of questions. How great is it that we actually have somebody coming at your door to help you answer some of those questions? Those are people who are from Fitchburg, your neighbors, who live in your neighborhood and know the city, and they're knocking on your door to really help you understand why the vaccine is so important, the benefits of it, and how to get connected to the vaccine. They also have flyers, and those flyers, we give them the flyers once they're developed to see if there's any vaccination clinic happening that weekend, so they can actually give it at your door. I'm like, you need the vaccine, here you have where to go in your neighborhood, and they speak the languages. So that's part of the effort. The other part of what we're doing is we're working very closely, directly with the municipal officials in determining what is happening, what's needed, in terms of which ones are the populations that have more questions, that have more concerns, and how to address them. And we're also working with these community partners, what I called before the community-based organizations, New View communities, and making opportunity count. But we're also working very closely with organizations based out of Leominster, and they're kind of combining efforts to ensure that our communities are served, including, for example, Catholic Charities, including the Spanish American Center. So we are getting together to address the concerns, to bring the vaccination clinics to our communities, to answer questions in your language, and to really target the efforts to those communities that have extra barriers to access the vaccine, because they were the ones that actually were the hardest hit because of all these social determinants of health that you mentioned.
So a large grassroots effort to talk to people individually and answer their questions, because sometimes, you can reach people with social media or with TV or through the mail, but some people need to have a conversation with someone and really be able to ask questions with someone one-on-one.
That is exactly the approach. It's like targeting one person at a time. Every person has different reasons why they may be delaying getting the vaccine, or they may be they may be exposed to a lot of misinformation. There's a lot of information going around and not all of it is accurate. So we just want to make sure that we provide information that is factual, that is based on science, that is based on what the Department of Public Health is producing based on the CDC, so that people have access to the most accurate information that can help them make the best decision for them and their families. And I think it's very important what Cecilia said before, which is you're not just getting the vaccine for you, you're getting the vaccine for everybody else in your family, in your community, in your neighborhood. We're protecting our families because, as she said, there's some people who cannot get the vaccine, whether because they are not, there's no vaccine for certain ages, like if you're 12 and under, there's no vaccine. If you cannot get the vaccine because you have a medical reason, medical problems, or because your immune system is not working because you may have had a transplant or so forth. Even if you get the vaccine, you may not develop the immunity that would protect you. So for those people who cannot get the vaccine, that's why we all need to get the vaccine. And we're here to really provide that information so that people understand that this is the time to step up. Like if there has been a time in a year in which we need to like show that we care for others, this is it. And we're trying to like make people understand that the importance of getting the vaccine, but also understand the benefits and answer any questions that they may have. And as Cecilia said, it's very common to have questions, very normal to have questions about this vaccine, because we've never seen ourselves in this situation before in our generations, right? But that's why we're here to like make sure that all of us have the information we need to make the right decision.
And we are seeing outbreaks currently and upticks in COVID-19 virus in people in the unvaccinated populations. So it's all the more important to make sure that you are protecting yourself and you are protecting your family that may not be able to get the vaccine for children 11 and under, or those with compromised immune systems or allergies such that they can't get the vaccine. Thank you so much, Maria and Cecilia. Are there anything that you wanted to add before we close this segment? Sounds like we covered everything.
I just wanted to say if you...
Oh, okay. Continue, Cecilia. Sorry, there was a little lag.
I just wanted to say if you have any questions, please don't doubt in contacting your primary care physician, in reaching out to those around you. They will answer your questions in your particular case because not everybody is the same. If you have any doubt, any doubt at all, please reach out. I'd rather you ask the question than stay at home and be unvaccinated.
All right. Great. Thank you so much, Cecilia and Maria, for coming on. And thank you so much for watching at home and protecting yourself and protecting your community by getting the COVID-19 vaccine. We will take a short break, and then we will come back, and this segment will be back in Spanish for our Spanish-speaking audience or for our bilingual audience as well. Thank you so much, and we'll see you in a few minutes.
Excellent opening move. Right, this opening lines for the big.
Bienvenidos, mi nombre es Alexander Vera y hoy estamos aquí para hablar de la vacuna del COVID-19. Tenemos Cecilia Luján, ella es la especialista de divulgación en el Departamento de Salud Público, y también tenemos María González, ella es la directora de comunicaciones de Salud Immigrante. Bienvenido.
Gracias.
Muchas gracias.
Estamos hablando sobre la vacuna de COVID-19 y en la comunidad de nosotros, de Leominster, Fitchburg, porque nosotros ahora mismo somos de la comunidad más afectado del virus. Y te quería preguntar, ¿cómo trabaja una vacuna?
Bueno, muchas gracias por tenerme aquí. Las vacunas funcionan de tal manera de que cuando uno las recibe, su cuerpo y el sistema inmunológico está recibiendo la información para poderse defender en el caso de enfrentarse con el COVID-19. La vacuna está llena de proteínas y esa proteína le da como un plan de acción a tu sistema inmunológico para que en el momento de enfrentarse con el COVID-19 sepa cómo actuar. La vacuna no incluye pedazos o rasgos del COVID-19, es una proteína. Ahora mismo en los Estados Unidos hay 3 opciones de vacuna. Está Moderna y Pfizer, y esas 2 vacunas se administran con 2 dosis. Entre cada dosis hay que esperar entre 3 a 4 semanas para administrar la primera y la segunda. Para los que prefieren una sola visita al médico o a la clínica que tenga a su disposición, está el Johnson & Johnson. Funciona de la misma manera, utiliza una proteína diferente, pero igual le enseña al sistema inmunológico cómo defenderse contra el COVID, y esa se administra con una sola dosis. De acuerdo, no importa cuál de las opciones de vacuna utiliza, si se pone las de 2 dosis o la de 1 dosis, después de la última administración, uno debe de esperar 2 semanas para considerarse completamente vacunado.
Perfecto. Y algo importante que tú notaste es que la vacuna no tiene el virus COVID-19 adentro. Son proteínas que tiene para poder enseñar a tu cuerpo cómo hacer para como para pelear el virus, ¿verdad?
Exacto.
Perfecto.
Exacto.
¿Y cuáles son los beneficios de la vacuna?
Bueno, aparte de que tu sistema inmunológico va a poderse defender contra el COVID-19, al vacunarte tú, estás protegiendo a las personas alrededor tuyo que de pronto no puedan vacunarse. Por ejemplo, ahora mismo uno se puede vacunar de los 12 años en adelante si utiliza la vacuna Pfizer. Si utiliza Moderna o Johnson & Johnson, tiene que esperar los 18 años. Cualquier persona de cualquier edad puede contraer el COVID-19. Entonces, nuestra manera de ayudar a los... Yo, por ejemplo, tengo 2 niñas, una de 5, una de 6 años que no se pueden vacunar. Yo las puedo proteger a ellas. También hay personas que su sistema inmunológico no funcionan de la misma manera que la de nosotros, que se le dice que tienen el sistema inmunológico comprometido. Esas personas no se pueden vacunar porque es que no va a tener ningún efecto en sus cuerpos. Esas personas de todas maneras merecen ser protegidas. Entonces, si nosotros recibimos la vacuna, no solamente nos estamos ayudando a nosotros mismos, sino a los que están a nuestro alrededor. Algo que dijo Sam antes y que yo he empezado a leer en varias vallas. La vacuna sí salva vidas, no solamente la tuya.
Muchas gracias. ¿Y cómo sabemos si la vacuna es seguro? Porque yo sé que hay un miedo en la comunidad hispana que la vacuna va a empezar a causar mucho efecto.
Claro, los hispanos tienen una falta de confianza alrededor de la vacuna y yo los invito a que se nos acerquen, ya sea a profesionales de salud o a su propio médico de cabecera, a hacer las preguntas que les nazcan, porque uno siempre gana más poder al tener conocimiento. La vacuna eh, pasó por el mismo sistema que tiene que pasar cualquier medicamento para ser aprobado en los Estados Unidos. Mas, sin embargo, cuando esta vacuna fue aprobada, yo les voy a ser muy sincera, hasta yo me sorprendí de qué tan rápido fue aprobada. Para mí, lo más rápido que se ha aprobado un medicamento a través de la CDC y la FDA, que son las entidades que aprueban este tipo de tratamientos, ha sido de 4 años. Pero han habido unas diferencias que uno tiene que tener en cuenta. El COVID-19 creó una pandemia mundial. Todas las economías a lo largo del mundo, no solamente de los Estados Unidos, se fueron de pausa, se fueron de pique. Entonces, toda la atención, todo el enfoque fue cómo resolvemos el COVID-19. Ahora, el COVID existió antes de esta pandemia, pero el COVID-19 fue mucho más contagioso. Entonces, los líderes mundiales se han reunido y determinaron que todo el trabajo científico se tenía que centrar en buscarle una solución al COVID. Por ende, muchos científicos que estaban trabajando en otros proyectos fueron llamados a trabajar en este. Mucha de la información que ya existía fue revisada y actualizada para poder ser utilizada en estos momentos. Y pues yo que trabajo en el gobierno sé que muchas cosas se atrasan a veces porque estamos esperando en otra persona. Pero si tu jefe todos los días te está diciendo, Cecilia, hola, ¿cómo estás? ¿Cómo está lo de la vacuna? Y mañana tú sabes que te van a volver a preguntar, tú estás trabajando fuertemente para poderle producir algo. Ya. Cuando se producieron las vacunas, que se dan cuenta, aquí en los Estados Unidos hay 3 marcas. Si ustedes tienen familiares en el exterior, se dan cuenta que hay diferentes marcas que también han estado trabajando. Lo que hicieron fue seguir el protocolo que siempre dirige la FDA y la CDC. Miles de personas en todo el mundo se prestaron como voluntarios. Ellos dijeron, yo me presto como voluntarios. En otras situaciones, uno tiene que buscar quién se preste voluntario, tiene que pagarles. La gente en esta ocasión lo hicieron de su propia voluntad. Miles de personas pasaron por las pruebas clínicas. Y otra cosa que también fue diferente al proceso normal es que la fabricación de la vacuna, o sea, el proceso para elaborar la vacuna empezó a la misma vez que la FDA y la CDC empezaron a revisar todas las cifras, todos los resultados de los estudios que se estaban haciendo. Entonces, normalmente primero se revisa esas cifras y después empieza la fabricación. Esta vez empezaron a suceder a la misma vez porque ya había seguridad en lo que se estaba produciendo. Mas, sin embargo, siempre siguen los estudios. Si se dan cuenta, nosotros empezamos a vacunar de 18 años en adelante. Poquito a poco pudimos decir que de 15 en adelante. Después pudimos decir de 12 en adelante, porque los estudios siguen. Todavía estamos recaudando información, revisando, mirando cómo afecta a una persona y no a otra. Y por eso es que poquito a poco es que se ha ido abriendo campo para diferentes grupos de edad. Pero esa es mi explicación para explicar el por qué tan rápido y si es seguro. Yo sí me siento segura porque sí pasó por el proceso de rigor, aún recibiendo una autorización de emergencia que es la que continúa de utilizar en estos momentos.
Muchas gracias, Cecilia. Esa información fue bien importante porque yo sé que hay una confusión bien grande allá afuera ahora con cómo hicieron la vacuna y por qué la hicieron tan rápido y cómo sabe que va a funcionar. So, muchas gracias por todo eso. Y ¿hay algunos efectos cuando uno se pone la vacuna? ¿Se va a sentir peor o mejor? ¿Cómo se siente la persona cuando se vacunan?
Cuando uno recibe la vacuna, bueno, yo les pongo el ejemplo de cuando yo vacunaba a mis hijas. Yo las llevaba y ese día el médico te decía, bueno, va a llorar un poquito y dale un poquito de ibuprofeno, de Tylenol. Y a las 24 horas los niños están perfectamente bien, pero ese día están como que les duele y eso. En ese proceso es el cuerpo recibiendo la información y aprendiendo qué es lo que tiene que hacer. Entonces, efectos secundarios son muy normales cuando uno se aplica una vacuna. En cuanto a la vacuna del COVID-19, hay varios efectos secundarios que son normales esperar, ya sea escalofríos, ya sea fiebre, ya sea náusea, ya sea, hay personas que también le ha salido ronchas en la piel, erupciones en la piel, así como hay personas que no les sale nada. Hay personas que le da un efecto secundario después de la primera dosis, que fue el caso de mi mamá. Ella tuvo COVID, de todas maneras se vacunó y es especialmente importante que si usted le dio COVID, de todas maneras se vaya a vacunar porque el efecto de anticuerpos no tenemos información de qué tan duradero es. Entonces es mejor aplicarse la vacuna aunque ya haya tenido COVID. Ella se la colocó, a ella le dio efectos secundarios la primera y en la segunda no le pasó nada. Mi hermana, que es enfermera, también tuvo COVID, también se vacunó, no sintió ningún efecto secundario. Yo no, que yo sepa, porque también uno pudo haber tenido COVID sin haber tenido síntomas, que yo sepa, yo nunca tuve COVID, me puse la Pfizer. Me dolió el brazo el primer día, después de la primera vacuna, a las 24 horas estaba perfectamente. En la segunda dosis de la vacuna sí sentí escalofríos, sentí fiebre, también sentí como, en inglés lo describen como una nubosidad, como cuando te sientes como no completamente, como, bueno, mi mamá es colombiana, como cuando uno siente que se va a enfermar, pero no está enfermo, que tiene la cabeza un poquito como debajo de agua.
Sí.
A las 24 horas yo estaba perfectamente. Lo que yo le sugiero a las personas es que estén pendientes de sus síntomas. Tomen mucha agua. Los médicos sí les dicen que pueden tomar ibuprofeno después de aplicarse la vacuna, no tomársela antes. Am, y estar muy pendientes porque hay algunos síntomas que sí debe de compartirlo con el médico. Siempre, siempre, siempre siente la seguridad y la confianza de ir a tu médico y decirle, me siento de tal manera, me siento de esta otra manera. También me gusta aclararle a las personas que este proceso es muy nuevo para nosotros. Nosotros nunca vivimos por una pandemia, nuestra generación. Y ahí es normal sentir ansiedad, sentir como miedo y susto en cuanto a este término, en cuanto a esta situación de la vacuna. No digo que el sentirlo desmerite nada. Es normal sentirlo, pero también tomar en cuenta que a veces el dolor de estómago puede ser el mismo nerviosismo. Mas, sin embargo, hay aplicaciones que se puede utilizar para seguir, como para establecer cuáles son los efectos secundarios que estás sintiendo. Si si sufres de alergias, es importante que le digas a tu médico si hay alguna razón por la cual tú crees que de pronto no debes recibir la vacuna. La mejor opción es hablar con tu médico y tu médico será el que dirá cuáles son los pasos a seguir.
Perfecto. Y otra cosa, si alguien quiere la vacuna, ¿cómo ellos pueden conseguirlo? Y también ellos pueden solamente entrar en cualquier CVS o Walgreens. ¿Cuál es el proceso?
Pues aquí le paso la batuta a María, porque ella es nuestra especialista en cuanto a la distribución de la vacuna.
Gracias.
Aquí la voy a tomar la batuta y muchas gracias. Pues en lo que es el Fitchburg and Leominster estamos trabajando para que las vacunas vayan directamente donde están las personas. Por supuesto que las personas pueden ir a las farmacias donde lo pueden hacer de manera directamente en la mayoría de las farmacias. Siempre es importante informarse primero porque cada farmacia funciona de una manera diferente. Luego tenemos los centros comunitarios de salud, tenemos a Community Health Connections, por ejemplo, que está haciendo también dando la vacuna. Creo que para eso tienes que registrarte para esas vacunas, pero lo que estamos haciendo es intentar hacer en coordinación con organizaciones comunitarias del área y también obviamente el Centro Comunitario de Salud y el municipio, las autoridades municipales, traer la vacuna a aquellos barrios y a aquellos vecindarios donde se necesita, donde podamos montar clínicas de vacunación, donde tengamos personas que hablan español, que hablan otros idiomas y podamos ayudar a las personas a superar esas barreras que tienen para acceder a la vacuna. Estamos trabajando con 2 organizaciones comunitarias en Fitchburg, pero tenemos otras organizaciones que también nos están ayudando en Leominster. Y lo que estamos haciendo es realmente hacer un esfuerzo conjunto en las 2 ciudades para que nuestras comunidades, que son las que necesitan más apoyo, tengan realmente esos recursos que necesitan para acceder a la vacuna. Yo les recomiendo que se pongan en contacto con Making Opportunity Count y con New View Communities, porque estas 2 organizaciones son las que nos están trayendo la vacuna, ayudándonos a dar la información en la ciudad de Fitchburg y trabajan obviamente con el Centro Comunitario de Salud. Esta semana no tenemos una clínica de vacunación planeada, pero estas clínicas se planean prácticamente todas las semanas, así que si están en contacto con estas organizaciones le van a poder decir dónde hay una clínica de vacunación que se vaya a implementar en los próximos días. Otra cosa que les quiero decir, y podemos hablar de eso un poquito más tarde, es que tenemos a personas que están tocando a sus puertas. Si hay una persona que llega hasta su puerta, que lleva una camiseta azul que pone Trust the Facts, Get the Vax, y que llevan un gorro también, esas personas vienen de parte del Departamento de Salud Pública, de parte de Healthcare for All, que es la organización que yo represento, y vienen de parte de lo que nosotros llamamos que es la Vaccine Equity Initiative, la iniciativa de acceso igualitario a la vacuna. ¿Y por qué es importante que usted les abra la puerta? Pues muy importante porque esa persona que es un vecino suyo de Fitchburg, que está tocando a su puerta, le trae información importante sobre la vacuna. Le va a decir, por ejemplo, si tiene algún tipo de pregunta con respecto a la seguridad de la vacuna, con respecto a los efectos secundarios de la vacuna, con respecto a las preocupaciones que tiene la gente y las barreras que tiene la gente sobre ¿me la puedo poner, no me la pongo, cuál es mejor? Todas estas preguntas la persona a su puerta le va a contestar. No le va a contestar tan bien como Cecilia, porque estoy muy impresionada sobre qué bien está hablando ella sobre las vacunas, pero sí que le van a dar esa información personalizada, y qué maravilla que tengamos a alguien de tu barrio que se preocupa por cómo está la salud en tu comunidad y que te puede contestar esas dudas uno a uno. Pero lo más importante es para acceder a esas clínicas de vacunación es que estemos en contacto con las organizaciones que están trabajando, o podemos ir al Centro Comunitario de Salud. Yo siempre digo, si tienes un médico de cabecera, un médico de atención primaria, habla con él, porque él también te puede poner en contacto con lo que es la vacuna. No dejemos también de nombrar que los proveedores de salud, las clínicas, los ambulatorios y tus centros y tus médicos de cabecera te pueden contactar también con la vacuna.
Perfecto, muchas gracias María. Y una cosa que tú dijiste fue que van a ver gente tocando puertas con una camisa que dice Trust the Vax, Get the Vax. Solamente para dar información. Ellos no están trayendo la vacuna para tu casa, ¿correcto?
No la están trayendo, ya llevamos 3 meses y medio tocando puertas, o 3 meses tocando a puertas. No llevamos la vacuna, pero se puede hacer si la gente está interesada. Y otra cosa que pueden hacer es que si la persona en la puerta está interesada en recibir la vacuna en su casa, eso se puede coordinar también. Le pueden ayudar a coordinar a que llegue una persona que va a vacunarle a su casa. ¿Y por qué es importante hacer esto? Porque cuando llamas a una persona para que venga a tu casa a vacunar, necesitan 2 personas, la persona que te vacuna y la persona que se queda contigo por esos 15 minutos, media hora que estaba hablando también Cecilia, que después de ponerte la vacuna te tienen que monitorear, te tienen que vigilar para ver si tienes algún efecto secundario. Entonces, las personas que están tocando puertas no son doctores, no son enfermeros, son personas que han sido entrenadas para compartir esa información con sus vecinos, porque ellos han querido formar parte de esta iniciativa, pero te pueden contactar con los proveedores de salud y con los enfermeros que necesitamos y ATS que decimos nosotros para poder darte esa vacuna.
Y otra pregunta, ¿la vacuna cuesta dinero? ¿Necesita una identificación, su tarjeta de seguro cuando va a vacunarse?
Bueno, es cuando decimos que las vacunas son gratuitas, yo quiero clarificar que las vacunas no son gratuitas en el sentido en el que han sido pagadas ya. Las vacunas ya se han pagado, las farmacéuticas las han hecho y el gobierno federal ha comprado muchísimas vacunas, ha comprado suficientes vacunas para todos los residentes de los Estados Unidos y para dar vacunas a otros países, de hecho. Entonces, hay vacunas de sobra y nosotros estamos diciendo a la gente, hay una vacuna reservada para usted. Usted tiene su vacuna, tiene derecho a su vacuna porque ya ha sido pagada por el gobierno federal. Entonces, su vacuna le está esperando. El gobierno federal ha pensado en todos los residentes de los Estados Unidos. Esa vacuna ya está pagada. Pero ¿por qué le preguntan a usted si tiene un documento de identidad, de identificación? Más que nada para mantener un poquito de control con respecto a quién ha sido vacunado y quién no ha sido vacunado. Y a usted le conviene tener una manera de justificar que usted ha sido vacunado, porque nos estaba contando hace un ratito, Cecilia, estábamos teniendo una conversación que a veces te están pidiendo ese documento de vacunación, te lo están pidiendo incluso cuando vas a bailar salsa, cuando vais a bailar, ¿verdad? Que los jóvenes van a bailar salsa, les están pidiendo el justificante de que han sido vacunados. Entonces, para mantener el registro de las personas que se han vacunado, es importante dar tu documento de identidad. No lo tienes, no pasa absolutamente nada, no es obligatorio tenerlo. Yo siempre digo que ayuda el tenerlo, facilita las cosas, pero si no lo tienes, tienes todo el derecho a recibir la vacuna. La otra pregunta que has hecho es, bueno, y entonces, ¿se necesita también algún otro documento de seguro médico? Tampoco se necesita el seguro médico, pero para que la gente lo entienda, aunque la vacuna, como el producto de la vacuna está pagado, la administración y la logística de la vacuna hay que pagarla. Pero eso no significa que la pague el residente o que la pague el consumidor. La tiene que pagar alguien, la tiene que pagar o su seguro de salud, si es que lo tiene, o el proveedor tiene que ser reembolsado por el gobierno federal. Entonces le van a preguntar si tiene seguro porque no saben quién va a procesar ese pago. Por eso se le pregunta. Ahora, yo también digo que aunque no necesite seguro médico para la vacuna, no hay motivo por el cual usted no tenga seguro médico en Massachusetts, porque tenemos programas para todas las personas independientemente de su estatus migratorio. En Healthcare for All tenemos una línea de ayuda a la que puede llamar al 800-272-4232. Tenemos personas que hablan inglés, español, portugués y le pueden ayudar a navegar el sistema de la salud y tener seguro de salud. Aún así, como decía, no se necesita. Y otra cosa importante para las personas que son inmigrantes, específicamente indocumentadas, pero también que tengan otros estatus, no hay ningún impacto en tener la vacuna con respecto a sus procesos de inmigración. No les impacta en lo absoluto. No tiene efecto en lo que se llama la carga pública. Al contrario, es mejor justificar que la persona ha tenido la vacuna y específicamente también las personas indocumentadas, el mostrar que uno se preocupa por la salud, no solamente la suya, la de su familia, pero también por la comunidad. Yo creo que tiene que ser algo positivo a la larga en sus procesos de inmigración.
Perfecto, y yo sé que nos queda nada más un minuto, pero ¿cómo sabemos que si la gente la quiere en la vacuna, la puede recibir?
Es que todo el mundo que quiere la vacuna puede recibir la vacuna. Ahora mismo no hay ninguna barrera. Lo que tiene que hacer es comunicarse con nosotros para que podamos decirle dónde puede conseguir esa vacuna y cómo. No hay ninguna, de verdad que no hay barreras. Ahora sí que voy a recordar una cosa, por favor, que la gente no baje la guardia, que todavía hay pandemia, que hay que seguir usando la mascarilla pese a todo, porque estamos viendo un incremento en los casos otra vez.
Perfecto, pues muchas gracias María, muchas gracias Cecilia. Eso será todo por esta noche. Que tengan buena noche y nos vemos pronto.
Adiós, gracias.
Gracias.